A lot of people will come into the office and ask me, what is a bridge, and how does the bridge operate versus having an implant? That is a great question. The difficulty I find with the bridge is that usually you're missing a tooth in an individual area. There's no tooth to be found, and sometimes you can't place an implant. But that's the beauty of a mini implant. Usually I can get a mini implant that will support a single tooth. So instead of taking two opposite teeth that are semi-healthy and having to prep those two teeth and put a fixed structure like a bridge, it's three teeth that are together and they're connected, and we cement those on. You're able to put an implant in between. But a fixed bridge is not a bad option. Many people would like to have a bridge, and depending on your health, sometimes that's more important than doing an implant. We prefer you do implants because we don't want to prepare the other teeth if we don't have to. Every time a tooth is prepared, you have a 25 to 27% chance of having a root canal on that teeth. So we'll prepare the two teeth, we'll build you a beautiful bridge that'll fit in place there, and you'll be able to chew. That will be permanent, it does not come out, and you'll be able to chew most any food without any problem at all.